I'm joined by Dr. Edelstein, who is a fertility specialist in Cape Town. We are going to be talking about birth control and the very controversial Yaz Pill. So thank you so much for joining me.
It's a pleasure.
Why, doctor, is Yaz and Yasmin so controversial?
You know, I guess that Yaz was one of the popular contraceptives, Yaz and Yasmin, one of the popular contraceptives introduced recently and has a wide uptake by patients. So it's probably one of the more common prescribed oral contraceptive pills. And I think as a result of that, it has borne the brunt of a scare about the risks of combined oral contraceptive pills that I would think is probably generalizable as a class effect rather than specific to Yaz.
Really? So most of these side effects that come up in this controversy actually could be side effects of any pill?
The combined oral contraceptive pill has two components, an estrogen and a progesterone component.
Yeah.
Initially, and the concern that we've seen in the media is the risk of a deep vein thrombosis and embolus from that. The coagulopathy is primarily class related to using an oral contraceptive pill. Mm-hmm. The concern was initially the estrogen component. That's been brought down to safe levels, and now there is a relative difference between the different types of progesterone and the progestogen. So I think that any of the oral contraceptive pills carry a risk of venous thromboembolism, which
what is that in layman's terms?
It's a clot in the leg,
okay.
A clot in the leg which can dislodge and lead to either problems with your lungs or with the brain.
And now, what makes Yaz and Yasmin different from these other pills?
So Yaz, the Drospirenone is the progestogen or progesterone component to Yaz, which was initially thought to have very favorable beneficial effects. Mm-hmm. So it has a almost like a diuretic component, so it leads to less bloating or breast tenderness that some women experience during their menstrual cycle. Okay. And that was one of the favorable. It also has an anti-androgenic component, so it's supposed to be favorable for their skin. So women who were concerned about mild acne and bloatedness and needed a contraception, this might have been a choice that you would have made.
Okay, so we spoke about the blood clot in the leg. That's the main concern here when we're talking about Yaz. What are some other side effects that may occur when you're on an oral contraceptive?
So I think that a large percentage of women who are on oral contraceptive pills will have no side effects and will only experience the benefits. And probably about 80% of women won't experience side effects. But those that do experience side effects may have mood change, may have headaches, may have breast tenderness, and may experience bloating, and those are the common, and nausea are the common side effects of the oral contraceptive pill. Okay,
we wanted to get your opinion on this. Do you think doctors should be doing a hormone test before prescribing an oral contraceptive?
So I don't think so. I think that what they should be doing is assessing the individual risks. So there are certain women that probably shouldn't be using oral contraceptive pills. Mm-hmm.
And who are those women?
Who are those women? So it would be the people that are at risk of the thromboembolism are going to be the more overweight, the obese woman, the smoker, the older person, somebody who's had a previous deep vein thrombosis or with a strong family history, somebody that's recently been immobilized. For example, if you're in bed because you've had a fracture, that would put you at risk. Okay. So I think that those people with those individual risks probably shouldn't be on oral contraceptive pill, on any form of oral contraceptive pill. And I think that only people that there is a value in doing tests would be those women who have a strong family history of thromboembolism. And there we're looking for, are there any inherited abnormalities in their blood clot profile?
I think I know your answer to this, but when should women absolutely not use Yaz or Yasmin?
So it would be people that have had previous deep vein thrombosis, cerebrovascular accidents, so stroke, heart disease, ischemic heart disease, angina, hypertension, poorly controlled diabetes, people with other medical conditions that put them at risk for clotting. Okay. Obviously there's certain cancers as well that you wouldn't want to do it. But there is the WHO, World Health Organization, have guidelines, and really the prescribing doctor should look at those guidelines before before prescribing.